There is a question that should be obvious by now and almost never gets asked. If everything in the first 10 volumes of this series is true, where is the doctor who can actually treat you this way? The answer is not encouraging. There is no medical specialty for bioenergetic medicine. There is no board certification. There is no residency program that trains physicians in the integrated framework these books describe. A patient who reads the previous 10 volumes and walks into a typical clinic will encounter a system structured to move them through 15-minute appointments, single organ specialists, and a billing infrastructure that pays for procedures and prescriptions and almost nothing else. And that, quite simply, is the gap. Volume 11 of the Living Energy series is called The Clinic, and it is the answer to the gap. It is a practitioner's handbook, the blueprint for what a clinic that actually delivers this kind of care looks like. The architecture of the team, the sequencing of the referrals, the training of the staff, the integration with a wellness center that does the work the clinic alone cannot. It is also, for the patient, a description of what to look for. Because once you know the structure of good care, you can begin to recognize its absence. Here is what the structure looks like. It is not a single physician. It is a team of 8. The first is the coordinating physician, the hub, the person who reads the labs through a different lens. Iron, copper, selenium, omega-3 index, vitamin D, heart rate variability, the markers most physicians never order, interpreted in the context of the 5 super levies. The coordinating physician is not the one who treats every problem. She is the one who maps every problem and sends each one to the right person. The second is the chiropractor, not for back pain, for posture, for the structural assessment that determines whether the airway is open or closed, whether the breathing pattern is sustainable, whether the lymphatic system can drain. Posture is a bioenergetic variable. Most physicians have never been trained to assess it. The third is the airway dentist. The dental chair in this framework is one of the most underused diagnostic seats in medicine. The shape of the upper jaw, the width of the dental arch, the position of the tongue, the grade of the tonsils. These tell you, before any sleep study, whether sleep apnea is structurally inevitable in this patient. The fourth is the myofunctional therapist. Most adults have swallowed incorrectly 1,000 times a day for decades. The tongue position is wrong. The breathing pattern is mouth dominant. The result, accumulated over years, is a structural shift in the face, the airway, and the autonomic nervous system. The myofunctional therapist retrains the pattern. It takes weeks. It changes everything downstream. The fifth is the sleep medicine physician, the one who reads the polysomnogram for bioenergetic data, not just for an apnea diagnosis. Sleep architecture, REM duration, heart rate variability during sleep, the repair window. Most sleep physicians look at the apnea-hypopnea index and stop there. The bioenergetic sleep physician looks at it as the beginning of the analysis, not the end. The sixth is the photobiomodulation and circadian practitioner, not a physician. A specialist trained in the application of red and near-infrared light, in dosing, in tissue targets, in the biphasic dose response that determines whether the treatment works or backfires. She is also responsible for the circadian protocol, morning light, evening darkness, the patient instructions that translate the science of Volume 9 into a daily practice. The seventh is the lifestyle medicine physician, nutrition, movement, mineral status. Not as a wellness afterthought, but as the substrate on which everything else depends. The omega-3 index, the seed oil exposure, the magnesium status, the metal cofactors that no one in standard care thinks to test. The eighth, and in some ways the most important, is the wellness center coordinator, the person who runs the facility where the rest of the work happens. The photobiomodulation suite, the infrared sauna, the cold plunge, the breathwork studio, the movement floor, the grounding garden. The clinic prescribes. The wellness center delivers. 8 people, 1 framework, 1 patient at the center, receiving care that is sequenced, coordinated, and repeatedly reviewed in case conference. This is what bioenergetic medicine actually looks like in practice. The book walks through every protocol, the intake model, the lab interpretation, the referral sequence, the case conference structure, the shared care plan, the outcome measurements, the business model, even the architecture of the wellness center itself. It is, for clinicians, the most complete description of an integrative bioenergetic practice that exists. For wellness center owners, the operational manual. For administrators, the staffing model and the financial structure. For patients, the map of what to look for and how to know when you have found it. The 3 patients from Volume 10 reappear here: Quantilis, Margaret, Ethan. But this time you see what each practitioner actually saw at the first encounter, what each one missed that the others caught, and how the case conference resolved the contradictions. The clinical narrative becomes a clinical case study. If you read Volume 10 and asked, "Where do I find this?" Volume 11 tells you. If you are a practitioner who suspected medicine could be more than the system you trained inside of, this is the volume that gives you the architecture to build it. The Clinic, Volume 11 of the Living Energy series. By Catherine Hornbeak. Read the book.